tuning fork. So the tuning fork is used to conduct the Weber and Rhine hearing test. So the tuning fork helps us test the patient's hearing acuity. So with the Weber test, let's see here. With the Weber test, the vibrating tuning fork is placed on the middle of the patient's head, and then you ask the patient to indicate which ear is louder. With normal hearing, it should be equal in both ears. And then the Rhine test compares hearing by air conduction with bone conduction. So the vibrating tuning fork is placed in the patient's mastoid process for bone conduction. The patient is asked when the sound is no longer heard, and the tuning fork is vibrating, by the way, for this test. So you'll swipe it down your leg, it's going to be vibrating, place on the patient's mastoid process. Ask the patient when the sound is no longer heard. So when it's no longer heard, we move the tuning fork to in front of the pinna, and this tests the air conduction. So the patient's again asked when the sound is no longer heard. So normally, sound is heard 2 to 3 times longer by air conduction than by bone conduction. Okay. And then with an otoscopic exam, the external ear canal, the eardrum, and structures of the inner ear are examined for any abnormalities. So imaging such as like a CT or an MRI can be used to help determine non-auditory problems. And then audiometry can help show whether hearing loss is only conductive or if it has a sensory neural aspect as well. Okay, so with management, let's go ahead and look at non-surgical and surgical management options. So with non-surgical management, we're going to be looking at early detection of hearing problems in the first place. So there's a couple different assistive devices that can be used, such as hearing aids, portable amplifiers, and cochlear implants. So hearing aids are helpful with conductive hearing loss, and they are less helpful with sensorineural hearing loss because they can make the hearing worse by amplifying the background noise. Cochlear implants can also be used, and they are helpful in patients with sensorineural hearing loss. As the problem is within the cochlea itself. One surgical procedure that's helpful for conductive hearing loss is a tympanoplasty, and this actually just reconstructs the middle ear, and it helps improve hearing. Okay, so let's go ahead and look at patient education. So first and foremost, we're going to be teaching about prevention. So patients minimizing exposure to loud music, wearing ear protection when they're at loud concerts, that kind of thing, and then avoiding putting foreign objects in their ears as well. We want to be teaching about hearing aid application as applicable and like cleaning and maintenance of the hearing aids as well. And we want to be using devices to help maximize communication and alternate methods of communication if needed. So like sign language, lip reading, closed captioning on the TV, kind of depending on their, degree of impairment. And then the assistive devices would just be hearing aids or cochlear implants or whatever the provider prescribes. 2 nursing concepts relating to patients with hearing loss include alterations in sensory perception and functional ability. So with changes in hearing, this not only alters their sense of hearing, but it also impacts their functional ability to do day-to-day tasks. Okay, guys, let's go ahead and go over the key points on today's lesson. So the difference between the types of hearing loss: conductive is an actual blockage of sound wave transmission. And sensorineural is a problem with the inner ear and the cochlea or eighth cranial nerve, such as damage to the hair cells of the cochlea. And then mixed is a combination of the two. So with this one, they'll have, partial conductive, partial sensorineural, and both will be occurring at the same time. There will be different assessment findings for each type of hearing loss, such as tinnitus for sensorineural, and then visual obstruction for conductive hearing loss. A tuning fork is a helpful diagnostic tool and helps us conduct the Rhine and Weber test, which help us to differentiate between the conductive and sensorineural hearing loss. So I also want you to remember the management, so use of assisted devices such as hearing aids or cochlear implants. And then a tympanoplasty if indicated. Finally, we want to be teaching about prevention. So wearing ear protection at loud concerts, preventing exposure as patients are able, using assisted devices as indicated, and different things to help maximize communication. Okay, guys, so that is all on our lesson about hearing loss. Make sure you check out all the resources attached to this lesson. Now go out and be your best self today. And as always, happy nursing.